then, when they don't use the drugs and they don't have that source available, and they look for the body's own natural production to create it, guess what? It's not there. And then that's what starts the withdrawal process. And so it results in a pattern of craving, going back to the drug, but now I'm not only going to just, if one is good, two is what? Better. And that starts that downward cycle of trying to get more and more, and then as the brain gets used to that, when we stop using it, then that's when the withdrawal symptoms kick in. So am I making sense to everybody so far? I don't see anybody sleeping yet. So I just want to make sure I'm keeping everybody's attention, because I know this can get a little bit too complicated. Okay, so we know that drugs of abuse, such as heroin, opiates, and cocaine, increase the release of dopamine. So it's like it's turning on more power to the chapel in hopes we can get more light. And that tends to produce a little bit more of a pleasurable experience for the person. And as they get more and more reliant on the drug to produce that experience, the brain stops producing its own, and it depends on that outside source for normal functioning. So let me give you a picture of a brain of what, this is a crystal meth user over here on the right, and this is some person who's healthy. So the red is the dopamine activity in the pleasure areas of the brain, right between your ears. And this is the brain's natural ability to produce dopamine with somebody who's been used to crystal meth. Is there just a little bit of a difference? That's a huge difference. And so this person is able to experience joy, laughter, gratitude when good things happen. And this person is sitting at the Christmas dinner and is isolated, not laughing at anything, not enjoying anything, and feels deadly alone, even though they're in a room full of people. And when we can see these pictures like this is not about willpower. This is just about neuroanatomy. Now, people will say, all right, but they made a choice to use and start this whole process. Okay, that's true. There is a choice of using and a choice to go back. I don't want to discount the fact that choice is a part of it, but we have many, many health behaviors that have choice involved. And so let's look at some other behaviors that have, other diseases that have choice components to it. So diabetes is a severe health condition. One of our good friends in our church small group, his sister just died. Was she in her 50s, Helen? In her mid-50s. And she died from complications related to diabetes. And she did not adhere to her medication. Now you would think just simple choice of taking your medication. That's simple. But we find that patients with diabetes, another health condition that has a big part of choice attached to it, less than 60% of patients comply with taking their medicine. Besides medicine, which is the easy part, less than 30% of those with diabetes actually follow the doctor's recommendations of changing their diet and living an exercise, active lifestyle. So the doctor says, you got to lose 50 pounds, you got to exercise 5 days a week, and we got to get you on a high-protein, low-carb, low-sugar diet. That's a choice. And less than 30% of patients with diabetes make those choices. Let's talk about another common health condition, hypertension, high blood pressure, and asthma. Patients who have those chronic conditions, which they don't go away, we just manage them, less than 40% of patients adhere to their medication, which is the easy part, and less than 30% of patients adhere to their diet and behavioral changes. So if we want to talk about and accuse or stigmatize people in addiction that they're just not following instructions, well, let's put this in the context of talking about a lot of other health problems. in our culture that we don't stigmatize. Now, what we do know, and this is where we see grace and mercy at work. Thankfully, with our testimonies that we have, and many of you in recovery here, you're living proof of the power of treatment, of the power of your will to live, and your power to face a lot of the physical challenges that addiction creates. So here you see a person who's a normal brain, their dopamine receptor levels. This is a crystal meth user at 1 month after detox. Still not much red, is there? Now look at him 2 years later. It's taken him 2 years of staying clean to start to get close to a normal person. Now they're still not the same, but we're getting close. And this is why when we talk about treatment models, the research shows the longer a person stays in treatment, the better their outcomes. Because the longer we can keep them engaged in a structured program where they can get their brains back to being like a normal, the good news is that their brains can pretty much function close to being a normal. Now, the problem where we run into with relapse is if the person starts using again, their brain starts going back to this one. And this is the challenge that makes recovery and relapse such an important hurdle that we can overcome so the person's brain does not regress back to this level of functioning. Okay, so that's kind of the end of the